Hello friends. There is a warning that almost nobody is talking about right now. And if you are 60 years old or older, it is the most important financial warning you will hear this year. Not because it is happening tomorrow, but because by the time most people find out about it, it will be too late to do anything to prepare. Most people who follow Social Security news know that the Social Security OSI Trust Fund is projected to run out of money in 2032. When that happens, every Social Security, retirement, and survivor check-in America gets automatically cut by 22%. But here is what almost nobody is talking about. 1 year later, in 2033, Medicare's hospital insurance trust fund is projected to be depleted. And when that happens, Medicare can only pay 89% of scheduled Part A benefits. That means an 11% cut to the program that covers your hospital stays, your skilled nursing facility care, your hospice care, and your nursing home care. Before we get into it, subscribe to this channel right now and turn on the bell. Changes like these arrive without personal letters and without reminders. The people subscribed here find out while there is still time to act. Subscribe now and let's get into it. Point 2 programs. 2 trust funds. 2 depletion dates, 1 year apart. And if Congress does not act before either one runs out, the financial impact on a retired couple could be devastating, not from one cut, but from 2 simultaneous cuts, hitting at almost exactly the same time. Let me start with the Social Security side, because the 2032 timeline just got worse than it was 12 months ago, and the reason it got worse matters. 1 year ago, the projected depletion date for the OSI Trust Fund was 2033. Today, the 2026 Trustees Report projects 2032. The date moved 1 full year closer, not because the economy worsened, but because Congress passed 2 laws in the past 12 months that increased benefits without adding any new funding. The Social Security Fairness Act, which restored benefits to millions of public sector workers, cost the trust fund approximately $196 billion over 10 years. The $6,000 senior tax deduction in the One Big Beautiful Bill will cost an additional $168.6 billion in lost tax revenue. Together, those 2 laws pushed the depletion date forward by approximately 6 months to 1 year for the average Social Security beneficiary currently receiving $2,071 per month. A 22% automatic cut means losing $456 every single month. For a retired couple both receiving benefits, the combined monthly loss could exceed $900 per month every month for the rest of their lives. Now let me turn to the Medicare side, because this is the warning that most people have genuinely never heard, and it is in some ways more alarming than the Social Security timeline. On June 23, 2026, the Medicare trustees released their annual report. The headline finding: Medicare's hospital insurance trust fund, which is Part A, is now projected to be depleted in the second quarter of 2033. That is 1 quarter earlier than last year's projection. The clock is moving in the wrong direction. On Medicare too, here is what Part A depletion actually means for you personally. When the hospital insurance trust fund runs out in 2033, Medicare does not disappear, but it can only pay what incoming Medicare tax revenue covers, which is approximately 89% of scheduled benefits. The other 11% becomes a gap. Who fills that gap? Under current law, nobody. The gap becomes an out-of-pocket cost that seniors must absorb themselves, or services get reduced, or providers get paid less and start refusing Medicare patients. All 3 outcomes are possible. None of them are acceptable for someone on a fixed income. Part A covers inpatient hospital stays, skilled nursing facility care after a 3-day hospital stay, hospice care, and some home health services. These are not optional luxuries for a 75-year-old with a hip replacement or a heart procedure. Part A is the difference between affordable recovery and financial catastrophe. The average cost of a single inpatient hospital stay for a Medicare beneficiary in 2026 is approximately $13,500 before Medicare Part A covers it. An 11% reduction in what Medicare pays means Medicare leaves approximately $1,485 of that bill uncovered per stay, not per year, per stay, and for seniors who need skilled nursing facility care after a hospital stay, which in 2026 costs an average of $9,000 per month, an 11% cut to what Medicare covers means approximately $990 per month in additional out-of-pocket costs for every month of skilled nursing care. Now here is the number that should stop everyone watching this video in their tracks. If both cuts happen, Social Security down 22% in 2032 and Medicare Part A covering 11% less in 2033, the combined financial impact on an average retired couple in that 12-month window could exceed $14,400 per year, compared to what they receive in what Medicare covers today. Now let me tell you what Congress is actually doing about both of these deadlines, because the answer to that question is more complicated and more urgent than most people realize. For Social Security, 3 proposals are currently being debated. The 6-figure limit would cap benefits at $100,000 per year for couples, raising the payroll tax cap, currently set at $184,500, would bring in new revenue, and the Cassidy-Cain plan would borrow $1.5 trillion to create a government investment fund. None of these have passed. For Medicare, the situation is different in an important way. The government has intervened to fix Medicare funding shortfalls in the past, and most analysts believe it will do so again. But the fixes that have been proposed involve raising payroll taxes on workers, which is politically difficult, or reducing payments to hospitals and providers, which is medically controversial. The critical point is this: the senators and representatives elected in November 2026 will be the ones who must vote on both of these fixes or allow both cuts to happen automatically. The 2026 election is not just a political event for anyone on Social Security or Medicare. It is a direct vote on your monthly income and your healthcare coverage. Now let me give you the exact planning steps you need to take before the end of 2026, because knowing both deadlines are coming is only useful if you adjust your plan while you still have time to do it. Planning step 1. Calculate your specific exposure to both cuts. Go to ssa.gov/myaccount and find your benefit estimate at full retirement age. Multiply that number by 0.78. That is your Social Security check. If the 2032 cut happens and Congress does not act, write it down. That number is the starting point for everything else in your retirement plan. Planning step 2. Review your Medicare supplement or Medigap coverage right now before the 2027 annual enrollment period in October. If you are currently on original Medicare only with no supplemental coverage, an 11% reduction in what Part A pays means 11% more coming out of your own pocket for every hospital stay, every skilled nursing facility admission, and every hospice service that a Medigap supplement plan, specifically Plan G or Plan N, can fill most or all of the gaps that an 11% Part A reduction would create. The time to review your coverage is now, not after the cut is announced. Contact a licensed Medicare insurance broker this month and ask specifically if Medicare Part A reduces its coverage by 11%. Which of my current policies would protect me? Planning step 3. Accelerate your emergency fund target. Most financial planners recommend 3 to 6 months of living expenses in liquid savings. Given that both Social Security and Medicare face potential cuts within 7 years, the appropriate target for a retired household should be closer to 12 months of living expenses, enough buffer to absorb both cuts, while Congress debates solutions that may take years to implement. Planning step 4. If you have not yet filed for Social Security, and you are between 62 and 69 right now, the 2032 trust fund timeline is something your filing decision must account for. Some analysts argue that claiming earlier makes sense before a potential cut. Others argue that a larger base benefit provides better protection even after a percentage cut. This is a decision that requires looking at your specific numbers, not a general rule that applies to everyone. For someone deciding between claiming at 67 versus waiting until 70, the difference is approximately $333 per month in 2026 benefit amounts. After a 22% cut, the person who waited until 70 still receives more per month than the person who claimed at 67, even after the cut. But the break-even calculation changes. Work through your specific numbers with a Social Security claiming specialist before you file. Planning step 5, and this is the one most people skip because it feels like something they can do later. Have the conversation with your adult children or trusted family members about both of these timelines right now, not in 2031, not when the first cut is announced. Now, because the decisions that protect a retired parent from these cuts require time, information, and coordination, and the families who have the conversation early have options that families who wait do not. So here is the complete picture of the double warning that most seniors have never heard explained. In the same place, warning 1. The Social Security OSI Trust Fund is projected to be depleted in 2032, 1 year sooner than last year's projection. At that point, an automatic 22% cut to every Social Security check takes effect unless Congress acts first. For the average recipient, that is $456 less per month. For a retired couple, potentially over $900 per month. Combined. Permanently, warning 2. Medicare's Hospital Insurance Trust Fund is projected to be depleted in the second quarter of 2033, 1 quarter earlier than last year's projection. At that point, Medicare Part A can only pay 89% of scheduled benefits. Hospital stays, skilled nursing care, hospice, and home health services all become 11% more expensive for every Medicare beneficiary in America. Both warnings, 1 year apart, and neither Congress nor SSA nor CMS has sent any personal letter to any of the 75 million Americans receiving Social Security or Medicare, explaining what these two timelines mean for their household finances. Your 5 planning steps are: calculate your benefit after a 22% cut using ssa.gov/myaccount and multiply by 0.78. Review your Medicare supplement coverage before October's annual enrollment period. Build your emergency fund toward 12 months of expenses. Work through your Social Security filing decision with a specialist if you have not yet claimed, and have the conversation with your family now, not in 2031. Subscribe. Share this with someone you know on Social Security or Medicare, and especially share it with their adult children. The families that plan for both of these timelines now will have options that the families who ignore them will not. And I will see you in the next one.